Hi, I'm Emily Tucker. I'm a licensed professional counselor in Birmingham, Alabama. I work with individuals who are trying to stop smoking, and I have a variety of approaches. One is hypnotherapy, and that approach is particularly helpful because it involves communicating directly with the person's unconscious or subconscious desire to stop smoking. We bring in the person and address all the reasons that the person wants to stop smoking, but also look at why do they want to continue smoking? How is this benefiting them? And we can address that in a safe environment and create a relaxed state of mind where we can provide messages to the subconscious mind and remind that person why they're doing what they're doing and making the changes that they're making. Having lost my mom to a smoking-related illness, an illness called PAD, which is peripheral arterial disease. This issue is particularly close to my heart. I also am a former smoker, so I understand what a smoker goes through, and I truly believe that the more times you try to quit, the more luck you have in your success, and that people can do it, and there's different approaches people can take. And I know the grip that it has on somebody who is struggling with it, and I know that help from an outside resource, whatever that may be, is something that people should hopefully consider. As far as comparing approaches of hypnotherapy to, say, a stop smoking technique that involves a nicotine substitute, the hypnotherapy is a direct therapeutic approach involving just the individual and their therapist, and perhaps maybe something like a CD they can listen to reinforce the instructions to stop smoking. If that's what they want, they can provide that information to their therapist, and that can be provided. That's very different from a nicotine replacement type of quitting method, because a nicotine replacement is still putting nicotine in the body. This is a direct approach involving the individual, the personality, the mind, but is not continuing the dependence on the substance, the nicotine. So it's addressing it at a whole different level. Hypnotherapy is very different from the traditional myth that we may believe about the you're getting very sleepy kind of idea. That is not what hypnotherapy is in this setting. Hypnotherapy is just some different techniques. It could be a guided visualization, it could be a touch hypnosis that helps the person relax. There's just different strategies that we can use to help a person get into a very relaxed state. And in that state, they are aware, alert, always able to make decisions, always consciously retaining all of the information so nobody ever forgets anything when they're in the hypnotic state. It's just a very relaxed state where people are very receptive to positive messages that will help them make these changes.